Okay, so hello everyone. Today we will discuss a very interesting topic, that is the cardiovascular system. And this is by far the most interesting topic of general anatomy apart from the osteology. And we will be dealing with the most important thing, that is the blood vessels. Okay, you might have seen that if there is a simple puncture anywhere in your body, the blood oozes out. So let us discuss that system of the body, which is such an important system. Let us appreciate this in 3D for a minute. So this is skeletal system, which we will deal about later on. You can see if I just add on the arterial system and this includes all the important major vessels of the body. Okay, they even run within the cranium also. Okay, that also you will read region wise. So you can see so many vessels inside the brain. Okay, inside the skull you can appreciate so many important structures. We will read and learn every vessel when the time comes. So don't worry, it's very interesting. All that is something which is extremely important also. And you can see the beating heart, which is working tirelessly day and night. You can see if I hide the sternum bone, you can appreciate this beating heart. We will talk about this also in a while. And you can see the main pipeline in the center. Okay, and then you can appreciate a lot of small blood vessels which are running. Okay, so and even they go to the lower limb. Okay, and this is just a part of our story. Okay, so this is the arterial system which we are looking at. If I make it more complex, I am adding the venous system. Okay, so we have arteries, veins, okay, primarily, and then we have also the lymphatic system that we will take up separately later on. So right now we will be dealing with the circulatory system. So all these vessels when we are using the word, that is the artery plus vein. Okay, so you can see such a complex system, and by the end of first year you will be able to name each of this vessel for sure. At least I would say 95% of the vessels in the entire human body will be on your tips. Okay, so it seems to be very difficult right now, but trust me, it's not that difficult. Okay, so we will walk through that in a while. Let us come back. So as we do, remember that we have to discuss every topic as per the competencies. Okay, so we will talk about the same. So we need to learn about the difference between the blood vascular and the lymphatic system, then between the pulmonary and systemic circulation, then the differences, general differences between the arteries and veins. These are the most important ones and asked in the theory exams. Okay, so this is something which you cannot skip. Okay, even it is asked in Viva also. Okay, so this is one of the most important areas in this chapter which you have to focus upon, although this will be repeated in histology also. Okay, then the difference between the elastic muscular arteries and the arterioles. Okay, then the competencies do not finish, it's a very lengthy and important topic. Then we need to understand the portal system, and we will understand some examples where it exists. Then the concept of anastomoses, this word you will hear multiple places in the region wise anatomy also. Similarly, you will hear the word collateral circulation multiple times. In the textbook also you will read. Then the significance of end arteries, that is also in itself concept. So this concept of these three words is extremely important for Viva as well as theory. Okay, so this is something you cannot afford to skip at any cost. Okay, so then we have the functions between the meta arterioles, pre-capillary sphincters, arteriovenous anastomosis, or known as AV anastomosis, AV arteriovenous. Then clinically, all these terminologies we should be well versed with. What are these? The thrombosis, infarction and aneurysm. Okay, it should be infarction. Okay, so aneurysm. So all these things should be very crystal clear in your head. What are these? Although I have talked to you about the nomenclature in the first class, if you go through the anatomical terminology very class, you will be able to understand what we discussed there. So let us dive into this complex topic to make it very easy. So we have the cardiovascular system, okay, talking about the introduction here. Okay, we have the cardiovascular system. Okay, so this consists of two things: the heart, as we saw in 3D, as well as the blood vessels. Okay, so heart is the one which collects the blood and pumps it into the blood vessels. Okay, so what are these blood vessels? If we talk about, the blood vessels are the tubular channels. Okay, they are the tubular channels, okay, which provide passage for the blood circulation. Okay, so for the passage of blood circulation. Okay, so there are various types of blood vessels, primarily which includes number 1, that is the arteries. Okay, then we have number 2, that is the veins. Okay, then we have the capillaries. Okay, so arteries are the one which carry the blood away from the heart. Carry the blood away from the heart. Okay, these things will be repeated eventually, so you will get to understand this basic core concepts in due course of time, but today we are discussing the general anatomy. So right now I am suspecting that you don't know anything about these words. Okay, so that way we are discussing this at the very core knowledge to build up the concepts. Okay, so veins, what will they do? They will carry the blood towards the heart. They carry the blood towards the heart, and we will see this in the form of 3D animation in a while regarding how this circulation happens. Okay, so you will remember it for your life. Then third category, we have the capillaries. Now you can imagine हार्ट के पास ब्लड लेके जाना और वहाँ से लेके आना, दिस इज डन. सो व्हाट इज लेफ्ट? वी नीड टू कनेक्ट द arteries and veins. We need to connect the arteries and veins, and that is done through the capillaries. And so I can say these capillaries are the they act as a site of metabolic and gaseous exchange. ठीक है, so this is about the basic understanding. Now let us talk about the functions of the circulatory system. Okay, so what is the use of having this system in the body? Okay, that is again a very important viva question itself. Okay, so the functions, number 1, as you can imagine, that is it helps to carry the blood. Number 2, it helps to exchange of nutrients, ठीक है, waste products, and what else? Any guesses? You have been hearing this from your NCRT also. gases, okay, with the tissue. Number 3, that is to transport the substances, and this you will deal in detail in the physiology. Number 4, that is a very important point, that is it regulates the blood pressure, extremely important again, that is BP. ठीक है, सुना भी होगा BP, blood pressure. Number 5, it directs the blood flow, it directs the blood flow to the tissues. So if any tissue is devoid of the blood flow, so it will lead to ischemia, that is lack of blood supply to that tissue, and further it can lead to the necrosis and infarction of that area. Okay. So this is something which you should be able to understand, the functions of the cardiovascular system. Next, let us talk about the components of the cardiovascular system. So cardiovascular system contains, as we discussed, the components of cardiovascular system. This includes number 1, that is the blood, okay. Then it has the heart, okay, and 3, that is the blood vessels. Okay, so we have 3 main aspects of this which you should be knowing. So blood, if you remember, blood is what? Blood is a specialized body fluid which circulates through the heart and the blood vessels, right? So it has similar characteristics with other connective tissue, like the blood is classified as a specialized connective tissue. If you remember from the last class, we discussed last class only, and these characteristics, they include, what are these which make it specialized? That is, the blood contains certain cells. Cells are RBCs, WBCs, the platelets, okay, and then you have the extracellular matrix which is in the form of plasma, okay, and then instead of connective tissue fibers such as the collagen, the blood contains soluble proteins. That is the fibrinogen, okay. This fibrinogen gets converted into insoluble fibers, that is the fibrin, and the blood actually makes up 8% of the total body weight, okay. So that is about the blood. So let us discuss regarding the composition of the blood. Okay, let us talk about the composition of blood, and this is very important point, please pay attention, okay. So the blood, it consists of, number 1, that is the plasma. Now plasma, this has certain proteins, okay, proteins such as the albumin, okay, what is globulin, and fibrinogen. These names will become familiar to you eventually, don't worry, and also it contains water and some minerals, okay. Talking about the second component of blood, that is the blood cells, which is very important, okay. Blood cells mein what is included? It has erythrocytes, it has erythrocytes, that is the RBCs, okay, and it has the white blood cells, that is the WBCs, okay. So that WBCs, it itself includes a lot of things, that is, number 1, neutrophils, We will talk about them in a while. Now actually this knowledge is very important. You might be able to see the blood test report, like that is the CBC. Okay, you might have got it done also in your life. Maybe there is a report of CBC report. Okay, that is a complete blood count report. If you just go through any report of yours or maybe your near and dear ones, you will be able to see all these components listed and there will be some percentage value written in front of it. And when you have viral fever or something, viral infection, you might have noticed that some of these parameters, they are deranged. Okay, so that itself is a very important parameter to remember. Eventually you will understand everything, but right now, so neutrophils, number one, that is, then we have the lymphocytes. We have the lymphocytes. Okay, then we have the monocytes, and we have the eosinophils, okay, and we have the basophils. Okay, then we also have another component in the blood cells, that is a very important component, I would say, that is the platelets. Okay, platelet count significantly decreases in a dengue patient, dengue या dengue जो भी बोलना चाहो. So you might have seen that also, news channels में भी बता देते हैं आजकल, तो it's very common sense now. People know this, you know, don't need to be a doctor to know this. People know this by default कि platelet गिर गए मतलब डेंगू हो सकता है, possibility है. ठीक है, so nowadays welcome to this world where the people are more educated than doctors. They think so. So they have Google, AI, Chat GPT, everything they have. So future doctors, you all have to become more smart than AI and the, you know, layman who already has plethora of information from the internet. So that will be important. Your clinical sense is important, that when you will understand which of these parameters are increased in which of the conditions, that you will be able to catch very fast, and that is your you know, knowledge, which is important. So let us talk about these things one by one. So we have number one, that is the erythrocytes. So now we know where they are in the list. Okay, so now we are just going to add some salient features or important points about these. Erythrocytes, we said that is the RBCs. Okay, so RBCs or the red blood cells, okay, these are the red blood cells. Okay, अच्छा मैंने यहाँ नहीं लिखा था, sorry. Let me just make it same. It is leukocytes. ठीक है, this is WBC. ठीक है, okay, so RBC और रेड ब्लड सेल्स, WBC और वाइट ब्लड सेल्स, उसका दूसरा नाम है ल्यूकोसाइट्स, इसका नाम है एरिथ्रोसाइट्स. ठीक है, so here we have the red blood cells. Okay, so now this red blood cells, they are disc shaped cells. They are disc shaped cells. ठीक है, and they do not have a nuclei. Do not have nuclei. Very important points I am telling you. ठीक है, I will show you in the photos also, you will understand in a while. And they have hemoglobin. ठीक है, they have hemoglobin pigment which helps in carrying the ऑक्सीजन, ठीक है. Then we have the next that is the white blood cells, or I can say leukocytes. Leukocytes or WBCs, ठीक है. So now these are further subdivided into two categories. Okay, so let us understand what are these. 1 and 2. So first category, that is the granulocytes, ठीक है, granulocytes. And second category we have the agranulocytes, ठीक है. So with granules and without granules, simple, ठीक है. So इसमें first category में we have numerous cytoplasmic granules, numerous cytoplasmic granules. Okay, for example, what will be the type of cells inside this granulocytes? That is the neutrophils, eosinophils, and the basophils, ठीक है. Compare this with the agranulocytes, which do not have specific cytoplasmic granules. They do not have the specific cytoplasmic granules, ठीक है. So classically अब कौन से रह गए इसमें? That is the lymphocytes and monocytes. Lympho and monocytes, ठीक है. Cytes मतलब cells, ठीक है. So that is about the classification. Further we have understood. Now let us understand the lymphocytes in more detail. Talking about the lymphocytes, ठीक है. Now this lymphocytes, they are very important classically, something you will hear again and again. So this lymphocytes, they are grouped into 3 types. Okay, so they are further of 3 types based on the presence of cluster of differentiation, based on presence of CD molecules, ठीक है. This CD means cluster of differentiation, ठीक है. So what is this? So there will be 3 categories. Number 1, that is the T cells. Just hold on. On the presence of CD molecules, this means cluster of differentiation, ठीक है. So what are these? Number 1, that is the T cells. Number 2, we have the B cells. Okay, and the third category we have the natural killer cells, ठीक है, that is the NK cells. Okay, so T cells, they are very important. T cells are responsible for cell mediated immunity, cell mediated immunity, whereas B cells, they are helping to maintain the humoral immunity, okay, that is of secreting antibodies. अब इसकी details you will get to understand in the pathology also, in physiology also you will read about this. So this will come in detail in that. Then you have the natural killer cells. They are the one, नाम से पता लग रहा है killer. So that is, they destroy the antibody bound cells. They destroy the antibody bound cells. ठीक है. And another important point to remember, that is the T cells, they mature in the thymus, okay. B cells, they differentiate in the bone marrow, okay, and they mature to form the plasma cells, and mature to form the plasma cells. These are the one which secrete the antibodies. ठीक है. So T cells thymus में mature हो रहे हैं, B cells bone marrow में differentiate हो रहे हैं. ठीक है. So this is something which you cannot skip. ठीक है. Then we have similarly another structure in the blood, that is the platelets. Very important. Platelets, they are minute fragments of the cell, okay, please remember, they are minute fragments of the cell, and they have small amount of cytoplasm. They have small amount of cytoplasm which is surrounded by what? That is a cell membrane. ठीक है. So in the bone marrow there is a structure, please remember, in the bone marrow we have something that is the megakaryocytes. ठीक है. These are the ones which give rise to the platelets, okay, and these platelets are the one which help to stop the bleeding, okay. They help to stop the bleeding because they are involved in the formation of blood clot. Okay, at the site of injury, and this again will be discussed in detail in the pathology in the second prof and also in physiology, okay. So you will get more details there. Right now I am just telling you what structure is there in the body and what is its function, okay. So in detail regarding the mechanism and everything, that is given in the guidance, which you can read in detail, okay. So here let us understand another thing, that is the functions of the platelets, that is also asked in the exams. The functions of platelets. ठीक है. So what are these? Number one, that is they secrete serotonin they secrete serotonin and thromboxane A2. Thromboxane A2, which causes it causes vasoconstriction, okay, and it helps to reduce the blood loss. Okay, and then you have number 2, that is derived growth factors. So there are platelet derived growth factors. Derived growth factors which help to promote the growth of cells. They promote the growth of cells at injury site. Okay. Number 3, we have the fibrinogen. Very important. Fibrinogen, that is converted into fibrin, okay, at again the injury site. Okay. So this is something which you cannot skip, and please remember this very important point. Okay, I am just drawing these lines. You can see previously also I used this just so that some people have sometimes, you know, they need neatness in the notes. So I am trying my level best to make it very clear to you. If you even go through the notes alone after the class, that should be more than sufficient. Okay, especially in the rapid revision time when you are very close to the exams. Then you have the component that is the plasma. Okay. So plasma, very interestingly, it constitutes the 55% amount of, it constitutes 55% of amount of the blood. Okay, and it is a yellow fluid. Okay, now this plasma, it consists of the plasma it consists of 91% water, okay, 7% proteins and 2% other solutes. Okay, and this plasma proteins, the plasma proteins, they include the albumin, and what else? They include the globulins and fibrinogen. Okay. So talking about them one by one, that is the albumin. Okay. Albumin is mainly produced in the liver. It is mainly produced in the liver. Okay. It helps to maintain the osmotic pressure. It maintains the osmotic pressure of the blood, and this osmotic pressure is actually essential for the water balance between the blood and the tissue. Okay. Then you have the globulins. Now globulins, they are the one which have the antibodies and the complement system. okay, antibodies and the complement system. This you will understand in physiology again. Okay, these are mainly the part of immune system of the body. Okay, then you have the fibrinogen. Now this fibrinogen this is something, the fibrinogen is something that is having the clotting factors, okay, and its activation form, that is a thread like protein fibrin, okay, that is the activated form in the form of thread like, that is the fibrin. Okay, so some albumins and some globulins, they are the carrier of hormones and other molecules. Okay, so another point to remember, that is the serum. There is a term that is known as serum. Serum is equal to plasma minus the clotting factors. Okay, this is again something you need to remember. Okay, so serum is asked in the exams. What is serum? So it is plasma minus the clotting factors. Everything in the plasma except the clotting factors. That is the serum. Okay, so this is something you need to remember. Okay, then let us come on to this image. Here we have the different type of white blood cells, which as we discussed already, but now let us see them with the help of certain images. Okay, so this will be again important in your examinations. So number one, we have the neutrophils. Then we have the neutrophils, basophils, eosinophils, monocytes and lymphocytes. And if you remember, there was the categorization granulocytes and agranulocytes, right? So here let us appreciate the features of each of them. So the nucleus is classically 3 to 5 lobed. Okay, so this is very important feature about the neutrophils. You can see there are multiple lobes of the nucleus, and cytoplasm, it shows pink or reddish purple granules. So there will be dot granules here, which you can appreciate. So this is again granulocyte only. So this helps in the phagocytosis of the microorganism. So it is very important cell, and the count of this is extremely important in case of a CBC report. Okay, so the key points, key takeaways here to remember: the 3 to 5 lobed nucleus and reddish purple granules, okay, and phagocytosis. These are the key words to remember. Then we have the basophils. Now basophils को याद करने के लिए blue, ठीक है, B से basophil, B से blue, ठीक है, so bluish. So you can see comparatively it is more blue, ठीक है. So the nucleus is segmented. Number one, एक ही nucleus लग रहा है, लेकिन ऐसा लग रहा है बीच में एक टुकड़ा हो गया है, ठीक है, so segmented है. The cytoplasm is dark basophilic granules are there. It contains the histamine. Extremely important from physiology point of view. You will understand and read it better. These cells, they help to release the histamine and they promote the inflammation. So inflammation का पूरा chapter है pathology में, which you will read about in detail. But right now understand inflammation is something which happens after the injury has happened. And that is the body's protective mechanism, natural way to heal the area. Okay, initially there is an inflammation. So what is the key point here? The nucleus is segmented and we have dark basophil granules which release the histamine and it helps to promote the inflammation. Okay, then we have the eosinophil which has the bilobed nucleus. Very important again. अब इसमें eosinophil है, ये pinkish color, ठीक है, dark pink color लेगा staining में. So you can see दो lobed nucleus दिख रहे हैं, ठीक है, so double lobed bilobed nucleus एंड साइटोप्लाज्म में डार्क इओसिनोफिलिक यानी पिंक पिंक बहुत डार्क पिंक कलर की डॉट्स दिख रही हैं, ठीक है। सो इसमें क्या था, डार्क पर्पल और ब्लू डॉट्स थी, ठीक है, इसमें रेड कलर की डॉट्स हैं। सो दिस इज डार्क इओसिनोफिलिक ग्रैन्यूल्स। अब इसका काम क्या इओसिनोफिल का, इट हेल्प्स टू फेगोसिटाइज द एंटीजन एंटीबॉडी कॉम्प्लेक्सेस, ओके, एक्सट्रीमली इंपॉर्टेंट फॉर इम्यून रिस्पॉन्स. So it induces the allergic reactions like in asthma, attacks the parasites also. So classically, remember, nucleus is bilobed, it has dark eosinophilic granules, and it helps to phagocytize the antigen antibody complexes, ठीक है. So there is something, and also it induces the allergic reactions, okay. Then we come on to the agranulocytes वाली category, that is the two sites, that is मोनो एंड लिम्फोसाइट्स. अब इसमें बड़ा इजी है, मोनोसाइट सबसे बड़ा है साइज में, जस्ट सी द साइज इज ऑल्सो, ठीक है, साइज भी बढ़ता जा रहा है. सो 12 to 20 माइक्रोमीटर सबसे हाईएस्ट साइज है, दैट इज मोनोसाइट, और फोटो में भी दिख रहा है. सो इन योर डायग्राम इफ यू ड्रॉ ऑन द साइड, इट शुड बी एविडेंट दैट मोनोसाइट इज लार्जर व्हेन यू ड्रॉ इट, ओके. देन यू हैव, दिस इज द किडनी शेप्ड न्यूक्लियस, जो सा क्लासिकल पिक्चर मिलती है, ठीक है, एग्जाम में पूछी जाती है, किडनी जैसे बीन शेप्ड, ठीक है. इट हैज़ टू फेगोसिटाइज द देन डिफ्रेंशिएट इनटू द मोनोन्यूक्लियर फेगोसिटिक सेल्स लाइक द मैक्रोफेजेस. सो मोनोसाइट से मैक्रोफेजेस बन रहे हैं. सो किडनी शेप्ड न्यूक्लियस है, ओके, एंड इट डिफ्रेंशिएट्स इनटू द मोनोन्यूक्लियर फेगोसिटिक सेल्स, that is example macrophages, ठीक है, very very important again, okay. Then we have the lymphocytes. Now lymphocytes, you can see as compared to the other cells, the size of lymphocyte is classically small as you compare the other cells, okay, and they have a round nucleus, बड़ा सा nucleus होगा पूरे सेल में और round होगा, ठीक है. So there will be a thin rim of cytoplasm. Cytoplasm ऐसे लग रहा है ही नहीं, ना के बराबर है, ठीक है. So thin rim, these are classical classifying, identifying features for these cells if you get the image based question. So T lymphocytes which help in cell mediated immunity, हमने डिस्कस किया था lymphocytes के बारे में. B lymphocytes help in the antibody mediated immunity. NK cells, they destroy the cancer cells, okay. So this we have discussed. It's a round nucleus, thin rim of cytoplasm, T lymphocytes, B lymphocytes and NK cells, तीन कैटेगरी थी जो हमने डिस्कस करी, ठीक है. So out of this I would say this one is important, this is important, this bilobed eosinophil is important, then neutrophil का 3 to 5 lobes is important, basophilic granules, histamine, ठीक है. These are certain one shot MCQs which you will get. T lymphocyte, B lymphocyte, NK cells, ठीक है. और इसका साइज ऑफ मोनोसाइट्स, द साइज ऑफ lymphocytes, दिस इज इंपॉर्टेंट, ठीक है. सो ये कुछ चीज़ें हैं विच यू हैव टू फोकस मोर अपॉन, ओके. देन वी कम ऑन टू द नेक्स्ट, दैट इज द क्लिनिकल इंटीग्रेशन, ओके. द क्लिनिकल इंटीग्रेशन, ठीक है, जो अभी हमने डिस्कस किया. सो नंबर 1, एज यू कैन इमेजिन, द फर्स्ट एंड द मोस्ट इंपॉर्टेंट वन इज द इम्यूनाइजेशन, ठीक है. सो दिस इम्यूनाइजेशन मीन्स, सो ड्यूरिंग वैक्सीनेशन और आई कैन से इम्यूनाइजेशन, द इनएक्टिवेटेड माइक्रो ऑर्गेनिज्म, और आई कैन से its part is injected or either given orally or nasally, okay. So like for example COVID की वैक्सीन थी, it was also an inactivated microorganism, ठीक है. So what will happen, this will activate the B cells to form the mature memory B cells, and they will remain in the dormant phase in the spleen, lymph nodes and other places, and on exposure to the microorganism or its antigen, these cells will then get activated to form for the B plasma cells, and they will produce antibodies which will protect the body through the humoral immunity. So this is a way of creating immunity by exposing the body to the same organism in an inactivated form. If suppose example like the rabies, okay, so you have already got the wound, the animal has bitten you, So now if it's a very severe wound, there are categorization of exposure also. If it is a very category 3 exposure, so in that case you are at a high risk of developing rabies. So in that case you don't wait for giving inactivated दोगे और फिर एंटीबॉडी डेवलप होगी, तब तक तो पेशेंट निपट लेगा ठीक है. सो उस केस में वी गिव द रेडीमेड एंटीबॉडीज, ठीक है. सो उस केस में वी गिव द ग्लोबुलिन्स. ओके, सो इम्यूनोग्लोबुलिन्स वी डायरेक्टली इंजेक्ट थ्रू द IM रूट, ठीक है. सो दैट इज समथिंग वेरी डिफरेंट, दिस इज समथिंग वेरी डिफरेंट. ओके, सो this understanding of the concept of immunization is very important. I hope you have understood it. If not, you can just repeat my audio which I have just said, so that you can listen again. Definitely you will understand. If not, you have the doubt portal also, you can ask me anytime. Then we have the blood. Okay, so blood, it acts as a route for the spread. Okay, this acts as a route for the spread of microorganisms, okay, the toxins, the cancer cells, and etc. Okay, so the list is endless. So there is something which you should be remembering. Next we come on to the heart. I know cardiovascular system में this is something you have been waiting for, that is the heart. ठीक है. So heart is a conical hollow muscular organ which is enclosed within the pericardium. I will show you in a while in 3D. First let me write the 4 chambers of the heart. Okay, so number 1, okay, it has 4 chambers. Number 1, we have the right atrium. Number 2, we have the right ventricle. Number 3, we have the left atrium. Number 4, we have the left ventricle. ठीक है. So there are 4 chambers of the heart. Let me show you in 3D only, it will be much more easy to remember. ठीक है. So if I just remove the skeletal system for a while अच्छा नहीं, रख देते हैं, ओरिएंटेशन अभी नहीं बनेगा अदरवाइज. ठीक है. So we are looking at the very first layer of cardiovascular system here. Okay, so you can appreciate this beating heart, beautiful intricate machinery. So if I just enclose this in the pericardium, so now you can see this is the pericardium which is covering it. So I can say it's a conical hollow muscular organ. Muscular means there is a muscle, that is the myocardium, which you will read in detail further. Okay, but this myocardium, this is enclosed within the pericardium. This is about the size of a clenched fist. Okay, अगर एक fist बंद करोगे, so almost इतना ही size का you have the heart, okay, of the individual. Okay, so there are 4 chambers. Let us understand them. ये हमने pericardium हटा दिया. ठीक है. उसके हार्ट को सप्लाई करने वाली वेसल्स भी हैं, कोरोनरी आर्टरीज, दैट ऑल्सो हैव रिमूव्ड. सो दीज यू विल अंडरस्टैंड बेटर इन द थोरैसिक रीजन. सो अब यहाँ पर वी हैव सर्टन चैम्बर्स विच यू कैन सी. सो इसको हम थोड़ा सा हाइड करके ओपन कर देते हैं. ठीक है. लेट मी ओपन ऑल दीज चैम्बर्स सो दैट यू गेट बेटर. स्केलेटल में हटा रहा हूँ अभी, इसको भी ओपन कर देते हैं एंड यू कैन अप्रिशिएट दिस ऑल्सो. इसको भी खोल देते हैं. सो आई हैव कट ओपन ऑल दी मेजर चैम्बर्स ऑफ द हार्ट. ठीक है. सो नाउ आई होप इट इज़ विजिबल. हाँ, सो नाउ यू कैन सी नंबर 1 वी हैव द राइट एट्रियम. ठीक है. सो राइट एट्रियम ये रहा. ओके, राइट एट्रियम ये वाला पूरा पार्ट है. सो दिस राइट एट्रियम, this has the thing which it receives the deoxygenated blood from the superior and the inferior vena cava. ओके, सो देख सकते हो ऊपर सुपीरियर और इन्फीरियर वेना कावा है. इसमें अगर मैं वीनस सिस्टम ऐड कर देता हूँ, यू कैन अप्रिशिएट बेटर, ठीक है। सो सुपीरियर वेना कावा ऊपर है, ओके, सो इसके ऊपर यू कैन सी दिस इज सुपीरियर वेना कावा and this is the inferior vena cava which is entering into this right atrium, ठीक है। so this is the first step of circulation. Then what happens, the blood gets transferred into the right ventricle, ठीक है। so इसके जस्ट नीचे पड़ा हुआ है यहाँ पर, ये मैंने वॉल इसकी हाइड कर दी। so this is the right ventricle जो हमने कट ओपन किया। so now the blood has to go through this valve, okay, so you can see this is the tricuspid valve, 3 कस्प हैं, 1 2 और 3, ठीक है। एक सेकेंड, हाँ 3 कस्प दिख रहे हैं, यू कैन सी दिस इज अ ट्राइकस्पिड वॉल्व विच इज ऑन द राइट साइड, ठीक है। सो इसमें से ब्लड एंटर करेगा अंदर, ओके, सो इट गोज इनसाइड दिस चैम्बर ऑफ द हार्ट, दिस इज द राइट एट्रियम, सॉरी राइट वेंट्रिकल, ठीक है, दिस इज द राइट वेंट्रिकल थ्रू विच इट एंटर्स द ब्लड इज गॉन टू दिस। सो नाउ टॉकिंग अबाउट द राइट वेंट्रिकल, द ब्लड that is a deoxygenated blood, it is passed to the lungs through the pulmonary trunk and then later pulmonary arteries, ठीक है। so you can see यहाँ पर blood आ चुका है, अब यहाँ से blood जाना है, so it will go through this vessel which you can see, यहाँ पर एक connection दिख रहा है, these are the pulmonary valves, okay, तो यहाँ पर ये pulmonary valves हैं, इसके थ्रू blood ऊपर चढ़ेगा और यहाँ जाएगा इस स्ट्रक्चर में, दिस स्ट्रक्चर इज द पल्मोनरी ट्रंक, इसका नाम पल्मोनरी है, लिंक टू द लंग्स, ठीक है। दिस विल फर्दर बाइफर्केट इनटू द पल्मोनरी आर्टरीज, द लेफ्ट एंड द राइट पल्मोनरी आर्टरीज, 2 लंग्स है हमारे पास, सो दोनों तरफ एक एक आर्टरी चली जाएगी, ठीक है। सो द ब्लड, डीऑक्सीजनेटेड ब्लड हमारा चला गया है अब लंग्स के अंदर। नाउ द ब्लड गेट्स ऑक्सीजनेटेड इन द लंग्स and through the gaseous exchange, then this oxygenated blood enters the heart through the pulmonary veins, okay, so now let us see where are those, so इसको हम रोटेट करते हैं, पीछे आ जाते हैं, this is the area, इसको अगर हम हाइड कर दें, okay, so this is the area where you see the pulmonary, इसको हाइड करना पड़ेगा थोड़ा ऐसे कयोटा को, ठीक है। so you can see this is the posterior side which you can appreciating. So this is the left atrium which is going to receive the blood on either side, दिख रहा है यहाँ पर 4 है, ठीक है। so you have 2 the pulmonary veins, 2 on either side, ठीक है। so the blood will, oxygenated blood will enter into this left atrium through the 4 pulmonary veins, okay, so then this blood will further pass to the left ventricle, so यहाँ पर हम इसको हाइड करते हैं, so you can see left atrium मैंने खोल दिया है, अब लेफ्ट एट्रियम से हमें ब्लड भेजना है लेफ्ट वेंट्रिकल में। सो नाउ द वॉल्व इज अ बायकस्पिड वॉल्व, इट्स नॉट अ ट्राइकस्पिड, यू कैन सी देयर आर ओनली 2 कस्प्स, ठीक है, एज कम्पेयर टू द अदर वन। देख लो बाकी कंपैरिजन में, यहाँ दूसरी साइड देखोगे 3 कस्प हैं, इधर 2 कस्प दिख रहे हैं, आई थिंक यू कैन सी नाउ, उधर एक साइड पे 3 कस्प हैं, एक साइड पे 2 कस्प हैं, ओके, आई थिंक इट इज शुड बी विजिबल, हाँ। सो अब इसमें लेफ्ट साइड पे वी एंटर फर्दर डाउन, अब हमें जो इसके अंदर जाना है, सो नाउ वी आर गोइंग टू द लेफ्ट वेंट्रिकल, ठीक है। सो लेफ्ट वेंट्रिकल में जाते हैं हम, लेट अस एंटर इनटू दिस चैम्बर ऑफ द हार्ट विच इज़ लेफ्ट वेंट्रिकल की वॉल हमने हटा दी, हम आ गए लेफ्ट वेंट्रिकल के अंदर, ठीक है। सो ये ओरिएंटेशन बन गया, दिस इज़ द लेफ्ट वेंट्रिकल जिसके अंदर हम यही वाला वॉल जो फ्लैप दिख रहे 2, so this is the bicuspid valve जिसके थ्रू हम एंटर कर चुके हैं, ठीक है। so blood has come into this left ventricle. Now interestingly this blood will be supplied to the entire body through aorta, okay, so यहाँ पर जो blood इकट्ठा हुआ ये एंटर कर गया through the aorta। अब यहाँ पर देखोगे these are the aortic valves which you will see, so यहाँ पर हम चले जाते हैं, so you get inside the aorta, okay, so you can appreciate this aorta, this is the vessel, this is the ascending aorta into which the blood is entering from the left ventricle, और इससे फिर ascending aorta से it gets further connected to the arch of aorta, arch of aorta से further 3 branches आती हैं, we will discuss that eventually, and उसके बाद फिर further डिसेंडिंग थोरेसिक आयोटा, और ये सारी मेन पाइपलाइंस हैं जो हम मेजर वेसल्स ऑफ द बॉडी में डिस्कस करेंगे डिटेल में, ठीक है। सो अभी एक मोटा यू शुड हैव एन ओरिएंटेशन कि ब्लड कहाँ जाता है, कैसे आता है, और हार्ट में एंटर कैसे होता है और हार्ट से निकलता कैसे है, दैट इज सिंपल थिंग विच यू शुड बी नोइंग बाय नाउ, ठीक है। सो दिस इज द टेक होम मैसेज फॉर टुडेज क्लास रिगार्डिंग द हार्ट, हाउ इट इज़ पंपिंग. सो हमने इसको काफ़ी चीर फाड़ के खोल दिया है बेसिकली, ठीक है. हमने इसको काफ़ी ज़्यादा कट ओपन कर दिया है. एंड ट्रस्ट मी, वेलकम टू MBBS. ये सारे जो स्ट्रक्चर्स दिख रहे हैं, ढेर सारे जो उभरे हुए पार्ट दिख रहे हैं, कुछ कुछ ग्लिसनिंग सा पार्ट दिख रहा है, कुछ सर्कल दिख रहा है, इन सब के अपने अपने नाम हैं. You will study them everything in detail, quite detail in the thoracic region, ठीक है. सो thorax में हार्ट और लंग्स हम बहुत डिटेल में पढ़ेंगे बिकॉज वो करिकुलम का पार्ट है. सो दिस वी हैव ऑल सीन इन द 3D, ठीक है. नोट्स में मैं लिख देता हूँ 3D, ताकि अगर कोई ये सोच के चल रहा है कि सिर्फ नोट्स पढ़ लेते हैं, सो उनको थोड़ा सा लगना चाहिए कि नहीं, नोट सफिशेंट नहीं है, सर ने 3D में कुछ दिखाया है, तो आई शुड वॉच द वीडियो ऑल्सो, आई शुड स्पेंड सम टाइम. ओके, सो दिस इज समथिंग अबाउट द हार्ट चैम्बर्स एंड रेस्ट ऑफ ऑल दीज डिटेल्स about these chambers, details will be covered in thorax, ठीक है. Okay. Then we come on to the blood vessels. The classification of blood vessels, ठीक है. So number 1, that is the arteries. Now as we know, arteries are the one which are carrying the blood away from the heart, capillaries which are nourishing the tissue, and whereas veins which carry the blood towards the heart, ठीक है. We have seen in 3D also. So now the blood vessels can be classified in the form of arteries, capillaries, veins. First category, that is the arteries. Okay. So this can be further divided into the elastic or the large arteries, okay, that is the conducting arteries, ठीक है. Then we have the muscular arteries, okay. Muscular arteries, they are the medium sized, muscular or the medium sized arteries, and they are the distributing arteries, ठीक है. ओके. All right. So then we have the arterioles, number 3. Okay, arterioles which have the terminal arterioles and the meta arterioles, ठीक है. टर्मिनल एंड मेटा आर्टीरियोल्स, दैट इज द सब क्लासिफिकेशन ऑफ द आर्टरीज. देन वी हैव नंबर 2, दैट इज द कैपिलरीज, ठीक है. कैपिलरीज, they are further divided into 3 categories, that is the continuous capillaries. Number 2, we have the fenestrated. We will look at them in detail. Fenestrated, or also known as visceral capillaries. And then we have the sinusoid or sinusoidal capillaries, ठीक है. Then lastly we have the third category, that is the veins. Okay, veins have veins have the further bifurcation, that is the venules. सॉरी, एक्चुअली वही कलर कोडिंग हम फॉलो कर रहे हैं, रेड फॉर आर्टरीज, ठीक है, एंड इसको हम दूसरा कलर कर देते हैं, ग्रीन कर देते हैं, ठीक है. सो रेड फॉर आर्टरीज, ब्लू फॉर वेन्स, विच यू हैव टू रिमेंबर फॉर एवर, ठीक है, जब ड्रॉ भी करोगे तब भी. सो वेन्यूल्स में क्या क्या आ जाते हैं, वेन्यूल्स में फर्दर वी हैव द पोस्ट कैपिलरी वेन्यूल्स, post capillary venules and muscular venules, ठीक है. And then we have the small veins, we have the medium sized veins, and lastly we have the large veins. Okay, so this is the gross classification of the blood vessels, ठीक है. So now let us discuss another concept which is again asked in your exams also, that is functional classification of the blood vessels, ठीक है. So let us write the functional classification of blood vessels. Okay. So here we have first category, that is the distributing vessels. Distributing vessels, इसमें classical example है arteries. Okay. Then you have number 2, that is the resistance vessels. Resistance vessels, ठीक है. So resistance क्यों कह रहे हैं, because they are the ones which are the main source of peripheral vascular resistance to the blood flow due to their narrow lumen and surrounding smooth muscles. Okay, so they are the ones which regulate the diastolic pressure. Okay, so if you want you can write a few words. The resistance vessels, they are the one which is the main source of peripheral resistance to the blood flow. ठीक है, due to their narrow lumen and surrounding smooth muscles. ठीक है. सो इसमें क्लास एंड ऑल्सो हाँ, दे आर द वंस विच आर regulating the diastolic pressure. ठीक है. सो इसमें क्लासिकल एग्जाम्पल्स में क्या क्या आ जाएगा, वी हैव द क्लासिकल एग्जाम्पल दैट इज arterioles with the precapillary sphincters. Precapillary sphincter. ठीक है. Then we have number 3, that is exchange vessels. Now exchange vessels, it includes the capillaries, ठीक है, sinusoids and the precapillary venules. Okay. Then we have number 4th category, that is the reservoir, or I can say capacitance vessels. ये सब फिजिक्स के टर्म्स है, ठीक है. सो दीज आर द लार्जर वेन्यूल्स एंड वेन्स. These are the larger venules and veins. ठीक है. Last but not the least, we have the fifth, that is the shunts. Okay, shunts which includes the anastomosis, sorry, which has the anastomosis. ठीक है. सो दोनों के बीच में कनेक्शन होगा, that is anastomosis. So let us see this flow chart here to understand things better. So first foremost we have the heart और last में भी heart. ठीक है. So हम start कर रहे हैं heart से, ख़त्म कर रहे हैं heart पे. So हमें circulation देखना है, कैसे heart से निकला blood और heart वापस कैसे आया. ठीक है. So सबसे पहले there will be some large or elastic arteries which are more than 10 mm in diameter. ये diameter बना दिया हमने. उसके बाद ब्लड हैज़ गॉन टू द मीडियम साइज मस्कुलर आर्टरीज, और इन दोनों के बीच में हिस्टोलॉजिकली यू शुड बी रिमेंबरिंग द डिफरेंसेस, यू विल अंडरस्टैंड लेटर. देन इट गोज टू द स्मॉल आर्टरीज, आर्टीरियोल्स, एंड फर्दर कैपिलरीज इज द स्टेशन वेयर द आर्टरीज एंड द वेन्स आर कनेक्टिंग टू ईच अदर. ठीक है, कनेक्टिंग लिंक है बिटवीन द टू. देन यू हैव द पोस्ट कैपिलरी वेन्यूल्स, बिकॉज कैपिलरी के बाद के वेन्यूल्स हैं ये. ठीक है. देन यू हैव द मस्कुलर वेन्यूल्स, जो मसल, ठीक है, सराउंडेड बाय मसल्स. देन यू हैव द स्मॉल वेन्स, देन फर्दर मीडियम साइज वेन्स सीक्वेंस में. देन यू हैव द वेरी लार्ज वेन्स जैसे कि सुपीरियर वेना कावा, इन्फीरियर वेना कावा, विच विल एंटर इनटू द हार्ट. और सबसे लार्ज इलास्टिक आर्टरीज में क्लासिकल एग्जांपल कौन सा हो गया? अयोटा, विच यू सॉ. ठीक है. सो वेन्स इन द, सॉरी, वैल्यूज गिवन इन द ब्रैकेट्स, दे आर द डायमीटर्स ऑफ द कॉरस्पॉन्डिंग वेसल्स एज यू कैन सी. ठीक है. So I hope it is clear to you what is the main, how the blood is flowing. Then we come on to this basic structure of the heart, basic structure of the blood vessels, which includes the different layers. Okay, so let me highlight them. The tunica intima, tunica media and tunica adventitia. इसमें भी highlight कर देते हैं. We have the large or elastic arteries जो important है, medium sized muscular arteries important है, capillaries important है. Then you have large veins and heart, which is very very important. इसको skip नहीं करना है, बाकी एक बार को याद नहीं भी रखोगे तो चल जाएगा. So then you have this, that is the अरे यार, हाँ, then you have this, that is the tunica intima, tunica media and tunica adventitia. अब इसमें tunica का मतलब क्या है? What is tunica? So just write tunica basically means a coat. ठीक है. So the blood vessels, they show three basic layers in a transverse section. So see, if you have cut it, so there are three basic layers, three layers in a transverse section. ठीक है. And the presence and thickness of these layers, it depends upon the size and type of blood vessels, as we already discussed. ठीक है. So first and foremost we have the tunica intima. एक second, हाँ, we have the first one, that is a tunica intima. Okay, now have a look and appreciate this tunica intima. इसको हम better रहेगा, just wait, इसको हम ना same color से कर देते हैं so that you get it clear. Tunica intima has the layers endothelium. Okay, so it has the layer endothelium. It see, सबसे पहले it is this tunica media, tunica intima, this is the innermost layer. ठीक है. तो सबसे पहला पॉइंट तो यही है, it is the innermost layer. ठीक है, सबसे डीप में, सबसे अंदर की तरफ है. It consists of certain layers. Now understand, first is the endothelium. Then you have this endothelium is the one which contains the simple squamous epithelium. Okay, then you have the subendothelial connective tissue. ठीक है, subendothelial connective tissue, endothelium के ऊपर. ठीक है. Then you have further, that is the internal elastic lamina. Okay, internal elastic lamina which is fenestrated in this case. ठीक है. So ये sequence है चीज़ों का. So you have number one endothelium, then you have internal subendothelial connective tissue, एंड देन यू हैव द इंटरनल इलास्टिक लेमाइना. मैंने बेसल लेमाइना टिक नहीं किया, बेसल लेमाइना पे एंडोथेलियम रेस्ट कर रहा है, दैट इज ओके, उसमें कोई बहुत ज़्यादा रॉकेट साइंस नहीं है, बट ये 3 मेन है जो इंपॉर्टेंट है, वाइवा में पूछे जाते हैं. ठीक है. सो दिस इंटरनल इलास्टिक लेमाइना, it consists of many fenestrated elastic sheets. Okay, and this fenestrations, they are helpful to permit the transmission of nutrients. Okay, so you can write this helps to transmit the nutrients. Transmits the this helps to transmit the nutrients. Okay, transmits the nutrients to the outer wall of blood vessels from its lumen. ठीक है, तो इसलिए फेनेस्ट्रेटेड चेक के साथ होना बहुत ज़रूरी है. ठीक है. सो देन वी हैव द नेक्स्ट वन, दैट इज द ट्यूनिका. वी हैव द ट्यूनिका मीडिया. ठीक है, ट्यूनिका मीडिया. अब इसको हाईलाइट कर लेते हैं, ग्रीन से ले लेते हैं. ट्यूनिका मीडिया. ओके, सो दिस ट्यूनिका मीडिया इज द मिडल लेयर ऑफ द ब्लड वेसल्स. ठीक है, सो यू कैन राइट दिस इज द मिडल लेयर. It is the middle layer. Okay, now what does this include? So middle layer जो है, this contains the concentric layers of spirally oriented smooth muscle cells with the elastic lamellae. ठीक है, and thicker tunica media, it contains more smooth muscles than that of veins. External elastic lamina is the one which separates the ट्यूनिका मीडिया फ्रॉम द ट्यूनिका एडवेंटिशिया विच इज़ द नेक्स्ट लेयर. ठीक है, सो ये एक एरिया हो गया जहाँ पर डिमार्केशन पॉइंट हो गया हमारा. एक्सटर्नल इलास्टिक लेमाइना, पहले क्या था, इंटरनल इलास्टिक लेमाइना. ओके, सो ये एक वेवी फॉर्म्स के तरीके से दिखेगा व्हेन यू सी अ हिस्टोलॉजिकल सेक्शन. सो दिस इज द एक्सटर्नल इलास्टिक लेमाइना विच इज़ विजिबल हेयर, एंड दिस smooth muscle cells of the tunica media, they are the one which can produce the contractions and relaxations under the autonomic neuronal control. Okay, then if we talk about the last layer, that is the tunica adventitia. Tunica adventitia, this is the outermost layer. ठीक है, this is the outermost layer. Okay, and this is also the connective tissue layer of the blood vessels. Okay, this is the connective tissue layer of the blood vessels. So let us see another thing in the form of flow chart. Here you can appreciate tunica intima, tunica media and tunica adventitia, and classically we have already discussed the layers. Okay, all these features we have seen on the photo, and you can have this in the form of a written in the form of a flow chart. Okay, so you can remember better. You have some vasa vasorum and nervae vasorum, elastic fibers, collagen fibers. This all things will come in detail in the histology. Okay, so I am not repeating it here. You will understand better when you get classes are going on, then you will understand these things much better. Here it will not be able to understand at this level. So the endothelium. Now coming to this endothelium, you can see this photo for understanding. So this is the blood vessel which they have actually taken a cut section. Okay, we have just removed a part of it. You can see the basal lamina, the endothelial cells, the nuclei in this endothelial cells. The blood may be flowing inside. Okay, so this may be the direction of the blood flow. So we are discussing the endothelium here. Okay, the endothelial cells. Endothelium. Now this endothelium has a lining epithelium of internal surface of the cardiovascular system. Okay, so this I can say endothelium is nothing but a lining epithelium of the internal surface of the cardiovascular system. ठीक है, so epithelium कौन सी है? That is we discussed, the epithelium is simple squamous epithelium. अब ये क्या चीज़ है? We will discuss in the histology in detail. ठीक है, so don't worry here. अभी सिर्फ नाम भी सुना होगा, that is okay. So this simple squamous epithelium actually has a flattened elongated cell. Okay, it has a flat elongated and polygonal cells, flat elongated and polygonal cells. It shows this shows small quantity of cytoplasm, small quantity of cytoplasm, and it has elongated flat, it has elongated and flat densely stained nucleus, densely stained nucleus. ठीक है, so adjacent endothelial cells, they are connected to each other by next point. And remember, मैंने लास्ट टाइम बात करी थी, देयर इज समथिंग नोन एज जंक्शनल कॉम्प्लेक्सेस. ठीक है, सो उसमें दैट इज दिस द एडजेसेंट, मतलब दो सेल्स आपस में, द एडजेसेंट एंडोथीलियल सेल्स. Okay, adjacent endothelial cells they are connected with each other by something known as tight junctions. ठीक है, they are connected to each other by the tight junctions. ओके, सिंपल स्क्वामस एपिथेलियम है इसमें, वेरी इंपॉर्टेंट पॉइंट. ठीक है, सो देन वी कम ऑन टू दिस फंक्शंस ऑफ द एंडोथेलियम. ओके, सो व्हाट आर द फंक्शंस? लेट अस सी. The functions of endothelium, number 1, it provides a smooth surface. It provides a smooth surface, non-adherent surface for the flowing blood columns. Okay, then you have second function, that is the selective permeability barrier. Selective permeability barrier. So this allows the movement of selected substances across it through the simple diffusion, pinocytosis, receptor mediated endocytosis, and transport of substances mainly depends upon its size and charge, that you will read more in detail in the physiology. Then number 3, third function is release of von Willebrand, स्पेलिंग देख लेना, von Willebrand factor, sorry, von Willebrand factor. ठीक है, so this is nothing but a plasminogen activator, inhibitor, ठीक है, inhibitor. So damaged endothelium, it releases the von Willebrand factor, which induces the platelet aggregation and the clot formation. Okay, so this is the one which induces the platelet aggregation, okay, and clot formation. ठीक है, okay. Then let us talk about the number 4. So fourth is the release of nitric oxide, that is NO, and prostacyclins. ठीक है, so these are nothing but the vasodilator agents. Okay, then you have the release of number 5, release of endothelin, okay, angiotensin convertase or angiotensin convertase enzyme. Okay, these are the vasoconstrictor agents. Vasoconstrictor agents, you will read more about them in detail eventually. So with the help of vasodilator and vasoconstrictor agents, the endothelium, it controls the blood flow through the vessels. Okay, then you have number 6, हमारे पास 7 और 8 लास्ट है, ठीक है, so you can have that space accordingly for writing. Then we have the hormone synthesis. ठीक है, so hormone synthesis, it synthesizes and secretes many growth factors such as colony stimulating factors, ठीक है, such as the colony stimulating factors. इसको नहीं लिखते CSF कहीं और बैठ जाएगा. The colony stimulating factors, ठीक है, fibroblast growth factors, ठीक है. Then we have platelet derived growth factor. CSF classically abbreviation यूज होता है for cerebrospinal fluid, तो इसलिए we are not using here, तो तुम लोग भी ध्यान रखना. Then we have the release of EDRF. What is EDRF? It produces this EDRF means endothelial derived relaxing factor. Okay, so now this EDRF this produces vasodilatation with the help of nitric oxide. ठीक है, last but not the least, that is the synthesis of दिख रहा है लिखा हुआ, हाँ, synthesis of type 4 collagen fibers. ठीक है, so it's responsible for the formation of basal lamina. ठीक है, so that is it about the endothelium. Next we come on to the arteries. So arteries have classical the features which are they carry the blood away from the heart. Okay, so features, they carry the blood away from the heart, ठीक है, and they have thick walled vessels. Obviously हमें आर्टरी में ब्लड पंप करना है और ये बहुत ही ज़्यादा थिक वॉल्ड वेसल्स होंगी. देन वी हैव स्मॉलर और रेगुलर राउंड ल्यूमेन, स्मॉलर और रेगुलर राउंड ल्यूमेन एज कंपेयर टू वेन्स. ठीक है, सो वेन्स का मैं बना देता हूँ. लाइक सपोज एक कट सेक्शन ड्रॉ करोगे बाद में, सो यू विल हैव अ सर्कुलर ल्यूमन फॉर एन आर्टरी एंड वेन का ल्यूमन थोड़ा सा इरेगुलर बनाओगे. ठीक है, कोलैप्स ल्यूमन भी हो सकता है अगर एक कट सेक्शन बनाओगे, सो कोलैप्स ल्यूमन होगा और दैट विल बी द, इसको थोड़ा सा और कम बना देते हैं, छोटा वेट, रेगुलर राउंड ल्यूमन फॉर द आर्टरी, ओके, एंड कोलैप्स्ड ल्यूमन फॉर द वेन. ठीक है, सो ये हो गया हमारा difference, major difference between the lumen for the vein and the artery. Okay, then the artery, they do not have valves. They do not have valves. Okay, then neurovascular bundle. So neurovascular bundle, arteries along with the accompanying veins and nerve, they form the neurovascular bundles. ठीक है, so arteries, okay, plus the accompanying veins and nerve, they form the neurovascular. vessels मतलब artery और vein और neuro means nerve. ठीक है, so ये एक classical चीज़ हो गई which you need to remember. Then we come on to the classification. Then we have the classification of the arteries. ठीक है, so on the basis of the characteristics of tunica media, based on the characteristics of tunica media. ठीक है, so there is classification that we already discussed, that is number one is the elastic artery or I can say large arteries. ठीक है, so these are the conducting arteries, right? These are the conducting arteries. Okay, so they have multiple layers of vascular smooth muscles and elastic lamellae in the tunica media. Okay, and diameter is more than 10 mm. So classical examples of this category, that is the aorta, pulmonary trunk. ठीक है, aorta, pulmonary trunk, मतलब जो क्लासिकल एग्जाम्पल्स हैं सब कैटेगरी में, यू नीड टू रिमेंबर देम. ठीक है, aorta, pulmonary trunk, just hold on. ठीक है, हमने 3D में देखा था ये कहाँ पर कैसे ओरिएंटेड है. देन ब्रेकियोसेफेलिक आर्टरी, we will read about this also eventually. Then common carotid artery, क्लेवियन आर्टरी, ठीक है, देन कॉमन आइलियक, ये सारी बड़ी इंपॉर्टेंट आर्टरीज हैं, ठीक है, एंड देन वी हैव द पल्मोनरी आर्टरी इटसेल्फ, ठीक है. सो दीज आर द इलास्टिक और द लार्ज आर्टरीज कंडक्टिंग. सेकेंड कैटेगरी थी हमारे पास, दैट इज द मस्क्यूलर आर्टरीज, ठीक है, और आई कैन से मीडियम साइज्ड आर्टरीज, muscular or medium sized arteries, they were called as distributing arteries, ठीक है, distributing arteries. So now what are the examples for this? So it is having muscular, so more smooth muscles and less elastic lamellae, diameter will be approximately 2 to 10 mm, and the prominent feature of muscular artery is presence of a greater number of smooth muscles and less amount of elastic material in the tunica media. Okay, so because as the name suggests only, you don't need to mug up, it's as per the name only. So because of this less amount of elastic material in the tunica media, the internal elastic lamina, that is a part of the tunica intima, this can be easily identified, okay, in these vessels. So examples for this, that will the brachial artery, ठीक है, पूछते एग्जाम में, then femoral artery, then we have other arteries of the limbs, ठीक है, we will study them in detail eventually. Then you have the third category, that is the arterioles. Okay, now arterioles, they are the smallest divisions of the arteries. They have only a single layer of smooth muscles and the diameter is also less, okay, 10 to 100 micrometers. So now let us see them in the photo, you will understand better. See this image. Here you can see the two, that is the medium sized muscular artery versus medium sized vein, okay. So now see the difference between the two. Here you can appreciate this wavy pattern, this is the histological image, H&E image, ठीक है, hematocrin eosin, ठीक है, hematoxylin eosin image, okay. So you can see H&E staining करोगे, you will read about this in histology. So ये यहाँ पर सबसे अंदर ल्यूमेन की तरफ there will be the endothelium, ठीक है, उसके बाहर ये जो इलास्टिक लेमाइना है, this is the internal elastic lamina obviously. Then you have, this is the tunica intima जो ये मार्क्ड है, फिर ये जो thick पार्ट दिख रहा है, दिस इज द ट्यूनिका मीडिया, देन फर्दर यू हैव द ट्यूनिका एक्सटर्ना, ठीक है. सो यहाँ पर ये इसको एरो को ट्रेस करोगे, दिस इज द ट्यूनिका एक्सटर्ना, इसमें ढेर सारे कोलाजन फाइबर्स हैं और स्मूथ मसल्स आर मोर इन द ट्यूनिका मीडिया, ठीक है. कंपेयर दिस टू द वेन, वेन में ऐसा कुछ नहीं है, वेन में यू कैन सी एंडोथीलियम तो है, लेयर्स तो तीनों मिल रही हैं हमें, लेकिन you can see there is not so many muscles, okay. So and the lumen is also collapsed, okay, it appears to be very irregular kind of lumen, okay, we will talk about that in a while. So then we come on to this, one more thing, that resistance vessels are the main source of peripheral resistance as we discussed, and the arterioles, which I was telling, arterioles are the ones which have diameter less than 50, ठीक है. सो अभी तक हमने डिस्कस किया था, दैट वाज फर्स्ट वन वाज द इलास्टिक और द लार्ज आर्टरीज, दिस हैज़ द ल्यूमेन, ल्यूमेन इज अराउंड डायमीटर इज मोर देन 10, ठीक है. देन यू हैव मस्कुलर आर्टरीज दैट हैज ल्यूमेन ऑफ द डायमीटर दैट इज 2 to 10, okay. Then you have here, that is the, this is mm, ठीक है, and you have this arterioles which has the diameter of 10 to 100 micrometer, ठीक है, or I can say even less than 50 sometimes, okay. So overall you can say less than 50 micrometer, okay. So the terminal arterioles are the ones which have the less than 50 diameter, okay. You can write it here, you have the terminal arterioles which have diameter less than 50 micrometer. ठीक है. Then in meta arterioles, the smooth muscles, they are replaced by the discontinuous non-contractile cells. Okay, so you can write an extra point here. In the meta, ये मेटा एआई नहीं है, मेटा आर्टीरियोल्स है. ठीक है, दो टाइप ऑफ आर्टीरियोल्स है ना, टर्मिनल और मेटा. सो मेटा आर्टीरियोल्स में व्हाट इज हैपनिंग, द स्मूथ मसल्स दे आर रिप्लेस्ड बाय discontinuous non contractile cells. ठीक है, and these cells are classically called as, they are known as pericytes. ठीक है, these are known as pericytes or also known as roget cells. ठीक है, so distally the meta arterioles, they form the capillary plexuses. Okay, then we have something known as arterial pulse. Now what is this arterial pulse? This is the rhythmic expansion and contraction of the arterial walls as the blood is ejected from the heart into the arteries during each heartbeat. So you can feel the pulsations at these places which are written here. You will read about them eventually region wise. Suppose देखा होगा डॉक्टर वेब सीरीज में, डॉक्टर्स व्हाट दे डू, नब्ज चेक करते हैं. सो यहाँ पर हाथ रखोगे, यू कैन सी द पल्सेशन. ओके, सो वी आर पैल्पेटिंग द रेडियल आर्टरी. ओके, similarly in the neck you have the carotid artery, in the foot you have the dorsalis pedis artery, posterior tibial, then popliteal. Okay, then brachial artery in the cubital fossa. Okay, so these are certain important vessels which you should be able to know. This is a brachial artery. ठीक है, misprint है, brachial artery. Okay, so the arteries which are palpated, they are very important clinically for examination because they give valuable information about the overall cardiovascular health. So you need to understand the presence or absence of these pulsations. Okay, so these are this arterial pulsations, clinically important. ठीक है, एंड इसको हमें चेक क्या करना है, वी नीड टू सी द प्रेजेंस और एब्सेंस. ठीक है, वी नीड टू सी द रिदम. ओके, देन वी नीड टू सी द रेट. ठीक है, एंड स्ट्रेंथ और आई कैन से एम्पलीट्यूड. ठीक है, इसकी डिटेल्स मेडिसिन प्रॉफ में और फिजियोलॉजी में पढ़ोगे. फिजियोलॉजी में विल रीड अबाउट देम. ठीक है, एंड ऑब्वियसली एनाटमी में जहाँ जहाँ रीजन वाइज आएंगे यू विल गेट टू नो अबाउट ऑल ऑफ देम. ठीक है, सो दीज आर द मेन पल्सेशंस, रेडियल, ब्रेकियल, कैरोटिड, डॉर्सालिस पेडिस, पोस्टीरियर टिबियल, पॉप्लिटियल. इवन वी हैव अनदर दैट इज अ femoral artery pulsation. ठीक है, so we have a lot of pulsations which are important. Then coming on to the capillaries. Now capillaries classically हमने starting में फिर remember we divided them into the three categories: the continuous capillary, fenestrated capillary, and the discontinuous or sinusoidal capillary. Right? So now this so capillaries, what are these? They are the network of vessels in the tissue. Okay, they are the network of vessels in the tissues and What else? They are the site of exchange of nutrients. Very important point. They are the site of exchange of nutrients. ठीक है, ये एग्जाम में पूछ सकते हैं इनिशियली जनरल एनाटॉमी का जब आइवा होगा. So what are these? And they have the diameter that is average diameter of 8 micrometer. It can range from 4 to 10 micrometers. ठीक है, ग्रीन से ही लिख रहे थे हम. 4 to 10 micrometers diameter हो सकता है. To be specific 8 micrometers. ठीक है. And human body has approximately 50,000 miles of capillaries. ठीक है, so अगर बिछाओगे तो बहुत लंबी कैपिलरीज हैं एक बॉडी में. So it consists of endothelium and a basal lamina. So दो चीज़ें हैं इसमें primarily. It contains the endothelium plus basal lamina. ठीक है. So there is no tunica media and adventitia in the capillaries. Please write this. There is no tunica media and tunica adventitia in the capillaries. Okay, in some capillaries you can see there are some pericytes which are present. ठीक है. So pericytes, they, as you can see, they are lying embedded in the basal lamina of the endothelium. These pericytes, they are embedded in the basal lamina of endothelium. ठीक है. So I hope it is clear to you what is it. Okay, so classification. Now classification is on the basis of three types. This three types are on the basis of the continuity of the wall and the basal lamina. ठीक है. So continuity में सबसे पहले कैटेगरी में continuous capillary आ जाएगी. ठीक है. So first category is the continuous. First is continuous, second is fenestrated, and third is discontinuous. ठीक है. So continuous are the capillaries, they have the continuous endothelial cells and the basal lamina. ठीक है. अब इसकी लोकेशंस याद रखनी है. ठीक है, लोकेशंस आर इम्पॉर्टेंट फॉर ईच ऑफ देम. We have number one, that is a continuous. ठीक है. So continuous की they are found in the connective tissue. They are found in the connective tissues, muscles, skin, lungs, skin, lungs, and the central nervous system. ठीक है. Then you have the fenestrated capillaries. They are also known as the visceral capillaries. So as you can see in this photo, they have numerous circular openings. They are known as fenestrations or apertures or pores, and these pores are the one which makes it fenestrated category. Okay. But can you see another difference? The basal lamina. Basal lamina is continuous and it is covering the entire capillary. So that is the difference between the first one and the second one. Okay. Presence, location. This fenestrated capillary is present in the renal glomeruli. Okay. The pancreas, endocrine glands, okay, intestinal villi, ciliary processes of the eye, okay, choroid plexus and the gallbladder. There are numerous examples, you can remember few of them, okay. Then you have last, that is the discontinuous or sinusoidal or sinusoid capillaries. You can see what is the third category, is the worst category. We have the fenestrated endothelial cells and discontinuous basal lamina. So दो components हैं, just to recap, एंडोथीलियम एंड बेसल लैमिना. एंडोथीलियम बेसल लैमिना दोनों इंटैक्ट है, फर्स्ट कैटेगरी. सेकंड में बेसल लैमिना इंटैक्ट है बट फेनेस्ट्रेशंस आ गई एंडोथीलियम में, दैट इज सेकंड. थर्ड में दोनों में ही छेक मिल रहे हैं. सो फेनेस्ट्रेटेड एंडोथीलियल सेल्स प्लस डिसकॉन्टिन्यूअस बेसल लैमिना. सो क्लासिकल एग्जांपल्स, दैट इज द लिवर. इस पे एमसीक्यूज भी आ चुके हैं. दिस इज द लिवर example. The sinusoidal wall, it shows two special cells. These are the, in the liver you see the Kupffer cells, ठीक है, Kupffer cells, we will read them in histology. Kupffer cells, they are the phagocytic macrophages. Phagocytic macrophages, ठीक है. And they have the, liver has the ITO cells, ITO cells, that is the vitamin A storing cells, ठीक है. सो इसमें आ गए हमारे Kupffer cells और ITO cells, ये इंपॉर्टेंट है, ठीक है. सो दिस इज समथिंग यू कैन रिमेंबर. इट इज़ वेरी इजी, ओके, एंड दिस इज आस्क्ड इन द MCQs also. This is MCQ, okay. So then we come on to the flowchart is showing the same things which we discussed, ठीक है, सेम चीज़ है जो हमने डिस्कस करी अभी, okay. The capillaries, they have the functions like so overall if I say the capillaries, okay, so this capillaries, they are present in the liver, spleen, lymph nodes, bone marrow, endocrine glands, the adrenal cortex, okay, carotid bodies. So this last category, that is sinusoidal, okay, so you can write this. The sinusoidal is actually the one which is, some authors they do consider it as a separate group of vessels also, okay. So you can remember this. And if apart from liver examples are asked, let me write in the second page, okay. The third category, इसको हम थोड़ा सा elaborate कर रहे हैं, sinusoidal और discontinuous capillaries, उसमें वहाँ जगह नहीं बची, ठीक है. सो इसमें the locations, the liver which we discussed, liver, spleen, okay, lymph nodes, bone marrow, ठीक है, कितने इंपॉर्टेंट चीज़ें हैं, endocrine glands, like the adrenal cortex, ठीक है. Then hypophysis cerebri, that is the pituitary, hypophysis cerebri. Then parathyroid glands, ठीक है, and the carotid bodies, ठीक है. So these are the locations for the sinusoidal capillaries, ठीक है, इसको सॉरी, sinusoidal capillaries. Okay, So this is something which you should be remembering because it is asked in the exams, and some textbooks they will also mention that sinusoid is a separate group of vessels. Okay. So next we come on to the veins. Now veins, they carry the blood towards the heart, okay, as we know. Now talking about the features of the veins. The features, number one, that is it is thin walled as compared to the arteries, obviously. Okay. Second point is union of capillaries. It is formed by the union of capillaries or small veins. ठीक है. Or small veins. Then we have number third point, that is they are larger as compared to the arteries and they have an irregular lumen. Irregular lumen than the arteries. ठीक है, हमने कंपैरिजन करना है आर्टरी से. Number 4. So we have already discussed the arteries, we have discussed the capillaries. Now we are talking about the veins. Okay, so I hope it is clear to you the difference, how we are going in sequence. Okay, so fourth one, that is it provides the unidirectional blood flow. It provides a unidirectional blood flow. ठीक है. And number 5, large veins, they are surrounded by dead space. This is a very important concept which we will talk about eventually, region wise. Surrounded by dead space. Now this dead space, why so? Which will permit there to allow venous expansion. Okay, to allow their expansion. A vein है तो फूलेगी, ठीक है, to allow their expansion during the increased venous return. ठीक है, during the increased venous return. ठीक है. So that is it about the veins. Okay, which are the features of the veins. Then let us classify them. Classification of veins. Okay, so they are grouped into 4 types based on the size. Okay, so first category, that is the venules. Okay, so diameter is approximately 10 to 100 micrometers. Also green से लिखते हैं, चलो ठीक है, 10 to 100 micrometer diameter है. ठीक है. It receives these venules, they are, वो याद है flow chart, these venules, they are receiving the blood from the capillaries only. अब venules के भी further 2 types हो गए. ठीक है. First category is the post capillary venules, जो हमने डिस्कस किया था. It receives the blood from the capillaries only. They are lined by endothelium and pericytes. Okay. Then you have the muscular venules. ठीक है. They are lined by endothelium, 1 to 2 layers of smooth muscles and surrounded by thick layer of connective tissue. Okay. Then you have the number 2 category, that is the small veins. That is diameter is approximately 0.1 to 1 mm. Diameter is approximately 0.1 to 1 mm. ठीक है. This drains the blood from the muscular venules. Okay. Then you have number 3 category, that is the medium sized veins. Medium sized veins. And number 4 we have the large veins. ठीक है. So medium sized, they have the diameter around 1 to 10 mm. ठीक है, साइज बढ़ता जा रहा है, यू कैन सी. पहले माइक्रोमीटर में था, फिर mm में हो गया. लार्ज में डायमीटर कितना हो जाएगा, मोर देन 10 mm. ठीक है. सो मीडियम साइज वेन्स दे आर अकम्पनीड बाय मीडियम साइज आर्टरीज. एग्जाम्पल रेडियल वेन, टिबियल वेन. ठीक है, एग्जाम्पल्स लिख लो. चलो, मीडियम साइज में रेडियल वेन, टिबियल वेन, पॉप्लिटियल वेन. ठीक है, बहुत सारे एग्जाम्पल्स हैं. वेन्स के तो एग्जाम्पल्स कोई एग्जाम में बहुत ज़्यादा नहीं पूछेगा, बट जस्ट आई एम राइटिंग. सो लार्ज वेन्स इंपॉर्टेंट है, एग्जाम में पूछे जाते हैं. एग्जाम्पल्स लार्ज वेन्स के क्या हैं, that is actually here what happens, that tunica adventitia is the thickest layer of the large vein. Okay, so it consists of longitudinally arranged smooth muscle cells. So इसमें classical example superior vena cava, inferior vena cava जो हमने देखी थी. ठीक है, 3D में same. Okay, so you can see this photo. Here you can appreciate the capillary plexus in between. You have the venules and the arterioles which are connected to each other. You can see the pre-capillary sphincters which are here between this meta-arterioles. ठीक है. So what is happening? There is relaxed pre-capillary sphincters which allow the blood to pass through this capillary plexus. Sphincter relax हुआ हुआ है. अब suppose the sphincter is closed. ये close हो गया. So the blood is not allowing to pass. So it is not allowing to pass the blood through this capillary plexus. ठीक है. So this is an important aspect of the microcirculation and the role of precapillary sphincter and the meta-arteriole. ठीक है. So this is another concept which you will understand better in physiology. So you can see the classical differences between the artery and the vein. ठीक है, जो एग्जाम में पूछे जाते हैं. So this is something which you need to remember for viva plus theory exams. ठीक है, this is for viva and theory. So just differences फटाफट से देख लेते हैं हम. Important वाले differences I am highlighting. So wall, it is thicker than the vein, it is thinner than the artery. इसका lumen oval होगा, circular होगा, patent भी होगा, that is open होगा. ठीक है, which are the most important differences which you cannot afford to miss. And it is collapsed or irregular lumen. ठीक है. Then tunica media, tunica adventitia. अब tunica adventitia you can see it consists of the longitudinal smooth muscle cells and the elastic fibers in case of veins. In case of tunica adventitia of artery, it contains only the connective tissue. ठीक है. Talking about the tunica media of the artery, this is thicker than the adventitia of the arteries. Okay, and it consists of the many layers of smooth muscle cells and elastic fibers. ठीक है. इसमें क्या है कि this is thinner than the adventitia of the veins, media versus adventitia. ठीक है. It consists of smooth muscle cells, collagen fibers and fibroblasts. ठीक है. So in this artery we have all the 3 layers which are well defined. In case of this, in small and medium sized veins, all 3 layers are not clearly identified. So even if I just remove this difference, that will not be a problem. ठीक है, जो main difference है, that is these which I have highlighted. Then difference between the capillaries and the sinusoids. ठीक है, so classical difference size. Capillaries छोटी हैं, sinusoids are larger in size. Another thing, they are irregular in shape. Okay, this will be circular or regular in shape. इसमें lining epithelium endothelium है, and here we have the endothelium with the few phagocytic cells. ठीक है, even if you don't remember this, that is okay. Remember this, that basal lamina is continuous in capillaries and discontinuous in sinusoids. याद है difference between the sinusoidal और sinusoid, जिसको हम separate category भी बोल रहे हैं basically. So इसमें difference है basically. ठीक है. Then you can see the locations which are important for both. We have already discussed them. कॉन्टिन्यूस में हमने फर्दर क्लासिफिकेशन कर दी कॉन्टिन्यूस एंड द फेनेस्ट्रेटेड कैपिलरीज, ठीक है, और उसमें हमने कर दिया साइनोसॉइड। तो हमने कैपिलरीज के 3 कैटेगरीज पढ़ी थी, सो इसमें साइनोसॉइड वी हैव डिफरेंशिएटेड सेपरेटली। ओके, सो देन वी कम ऑन टू द क्लिनिकल इंटीग्रेशन। क्लिनिकल इंटीग्रेशन, okay, so the functions of the elastic arteries as a diastolic pump, it is very important. Okay, so number 1, the elastic artery as a diastolic pump, we have discussed this previously also if you remember, diastolic pump, ठीक है. So during the ventricular systole, the elastic arteries they dilate to acquire a sudden rush of blood from the ventricles, to accommodate the blood, I mean to say. So during the ventricular diastole, that is a relaxation, because of this elastic recoil, these arteries push the blood into the medium sized arteries and maintain the continuous blood flow. So thus I can say the elastic arteries they pump the blood during the diastole of ventricles, that is a relaxation phase of the ventricles. You will understand this much better in the cardiac cycle in physiology. Okay. Then second is the hypertension. Hypertension, it is a sustained diastolic pressure above 90 millimeters of mercury, okay, and sustained systolic blood pressure more than 140. So 140 by 90 millimeters of mercury के ऊपर अगर जाए, ठीक है. नॉर्मल क्या है, इफ यू नो, नॉर्मल इज 120 by 80 मिलीमीटर्स ऑफ मर्क्यूरी, ठीक है, ये नॉर्मल है. सो ज़्यादा कब कहलाएगा, बीपी हाई हो गया 140 by 90. सो दिस ब्लड प्रेशर, हाई ब्लड प्रेशर इज अफेक्टिंग मोस्टली इन द एल्डरली पॉपुलेशन. आजकल तो मिडिल एजेड में भी कॉमन हो गया. अफेक्ट्स elderly most commonly, ठीक है. बिकॉज एल्डरली में हम क्यों ज़्यादा बोल रहे हैं, बिकॉज ऑफ द इंक्रीज वैस्कुलर रेजिस्टेंस, एथेरोस्क्लेरोटिक चेंजेस. ओके, हम क्यों कह रहे हैं, इसका रीज़न भी है, बिकॉज इंक्रीज्ड वैस्कुलर रेसिस्टेंस, ठीक है, एंड द एथेरोस्क्लेरोटिक चेंजेस जो एज के साथ हो जाते हैं, एथेरोस्क्लेरोटिक चेंजेस, ठीक है, इंक्रीज्ड वैस्कुलर स्मूथ मसल सेल्स एंड डिक्रीज्ड अमाउंट ऑफ इलास्टिक फाइबर्स, ठीक है. सो इंक्रीज्ड वैस्कुलर स्मूथ मसल सेल्स, ठीक है, and decreased amount of elastic fibers, okay, and also increased amount of collagen fibers, increased amount of collagen fibers in the vessel wall, ठीक है. सो ये कुछ चीज़ें हैं बिकॉज ऑफ व्हाट रीजंस वी से कि एल्डरली में ज़्यादा कॉमन है हाइपरटेंशन, ठीक है. वाई वी आर सेइंग दिस, कि एल्डरली में ज़्यादा कॉमन है बिकॉज ऑफ दीज फ्यू रीजंस, ठीक है, राइट. देन वी हैव अनदर कंडीशन दैट इज नोन एज वेरिकोज वेन्स. इसके बारे में वी विल डिस्कस इन डिटेल इन द लोअर लिम्ब, ठीक है. हाइपरटेंशन यू विल स्टडी मोर इन डिटेल इन द मेडिसिन एंड फिजियोलॉजी ऑल्सो. So varicose veins, they are abnormally dilated veins. Abnormally dilated veins which are visible in the lower limbs. visible in the lower limbs in especially elderly again. ठीक है, हो depending upon the occupation also. ठीक है, again because of elderly में क्यों, because of the failure of the valves. Okay, because of the failure of the valves. ठीक है, ये मैं बता ही देता हूँ बिकॉज वैसे भी हम इसको डिटेल में डिस्कस करेंगे बाद में. सो दिस एल्डरली पॉपुलेशन वाई इट इज अफेक्टेड बिकॉज ऑफ द फेलियर ऑफ द वॉल्स, डिक्रीज्ड वैस्कुलर स्मूथ मसल टोन एंड ऑल्सो प्रोलॉन्ग्ड स्टैंडिंग. ठीक है, ये इंपॉर्टेंट है, प्रोलॉन्ग्ड स्टैंडिंग ड्यू टू प्रोलॉन्ग्ड स्टैंडिंग. ठीक है, जैसे कि सर्जन्स हो गए, पुलिसमैन हो गए. ठीक है, जो भी जिनके ऑक्यूपेशन में यू हैव टू स्टैंड फॉर मोर ड्यूरेशन. ठीक है, देन यू हैव समथिंग नोन एज द valves. Okay, venous valves. We have the venous valves. Okay. So to maintain the unidirectional blood flow towards the heart, the veins have the valves. Okay, so the valves, they help to maintain the blood flow against the gravity. Okay, and also from superficial to deep veins हमें अगर blood को transfer करना है, so valves are essential. Now each venous valve, they have cusp which make the valve open only in one direction. So valves, they are more numerous in the veins of lower limb to maintain the blood flow against the gravity. Okay, so valves near the termination of internal jugular, subclavian vein, femoral vein, they prevent the venous blood backflow during the increased intrathoracic pressure, like during inspiration, coughing, and also during the increased intra-abdominal pressure, like during defecation. Otherwise blood flow hamper hoga. Okay, so venous valves, there are certain veins which do not have the valves in their lumen. Okay, and so let us write them. We should be knowing. First category, that is the okay, so number one, we are going to discuss the veins which do not have valves in the lumen. Veins which do not have valves. Okay, what are these? So they are superior and inferior vena cava, SVC, inferior vena cava, hepatic veins, hepatic vein, portal vein. Okay, then renal veins. Okay, uterine vein, ovarian vein. Okay, pulmonary veins and the facial veins. Okay, so these are the veins which do not have the valves. Second kind of list which you need to remember is the veins which do not have muscular tissue in their valve or in their walls. So veins which do not have muscular tissue. Okay, do not have muscular tissue in their wall. Now what are these? Let us see. They are the dural venous sinuses, very important. We will talk about them in head and neck. Dural venous sinuses, pial veins, pial veins, okay, retinal veins, you will read about them eventually, don't worry. Then veins of erectile tissue of the penis. Erectile tissue of penis. ठीक है. Then veins of spongy bone. So you can remember any few examples, one or two examples of each. Okay. Then there are certain factors. There are certain factors which are helping in the venous return. ठीक है. What are these factors? Again very important एग्जाम का क्वेश्चन है ये. ठीक है. First, that is the Vis-a-Turgo effect. Vis-a-Turgo effect. So it's a forward push of the blood from behind by the blood pumped by the heart. Okay. Then second thing, the negative intrathoracic pressure. Thoracic pressure. So sucks the blood into the heart from all the major veins of the body. Okay. So then you have the gravity itself. Gravity helps in venous return from the upper part of the body. Then number 4, we have the muscle contractions. Muscle contractions. So they help to press the veins passing deep and through the substance of the muscles. So it also helps in venous returns. So classically there is a very important entity linked to this. So contraction of the calf muscle, for example, I hope you know contraction of the calf muscle. We will talk about that in lower limb. That is classically speaking the soleus muscle. Okay. It helps in the venous return from the lower limb, and this soleus muscle is therefore known as the peripheral heart. ठीक है. सो अभी तक हमें 2 हार्ट पता लग गए बॉडी में. ओके. सो दिमाग एक ही है हमारे पास. ठीक है. दिमाग ऊपर ही, घुटने में दिमाग होता है किसी किसी के, बट दिमाग एक ही है. ओके. देन यू हैव नंबर 5, दैट इज द आर्टीरियल पल्सेशंस. Arterial pulsations. Okay. So most of the veins, they are accompanied by the arteries, and these arteries pulsations, they also drive the venous blood towards the heart. Then number 6, which we already discussed, that is the venous valves. Okay. So they prevent the backflow of the blood and maintain the unidirectional blood flow. Okay. Then talking about the clinical integration of this topic. Clinical integration. So number 1, that is the site of venae puncture. Okay. Venae puncture. So collection of the blood samples, the superficial veins are commonly used for venae puncture. ठीक है. venae या venae puncture जो भी कहना चाहो. ठीक है. किसी किसी बुक में लिखा है. Then you have the second, that is the varicose veins, which we already discussed. So इसमें क्या होता है, there is dilated tortuous veins which are actually continuous on standing for a long period may induce the varicose veins, which is caused by the venous valve incompetence or weakness. ठीक है. So this results in the pooling of blood in the veins, superficial veins, and it occurs common in the vein of the lower limbs. So especially the great saphenous vein. So it can occur at the lower end of the esophagus or in the anal canal also. Okay, we will discuss that eventually. Then we have something known as anastomosis. Anastomosis. Okay, थोड़ा सा चैप्टर लेंदी है, बट इसमें बड़े सारे इंपॉर्टेंट कंसेप्ट है. अब एनास्टोमोसिस क्या चीज़ है? व्हाट इज दिस? इट्स अ कम्युनिकेशन बिटवीन द neighboring vessels between the neighboring vessels through a collateral channel. Through a collateral channel. ठीक है. So circulation through this anastomosis is collateral circulation only. So अब इसके type of anastomosis क्या क्या हो जाएंगे? So let us see. Types of anastomosis. Number 1, that is the arterial anastomosis, जो कि बहुत जगह पढ़ोगे. You will read about it multiple places. Then venous anastomosis and then arteriovenous anastomosis. ठीक है. AV anastomosis. So arterial, that is communication between the two arteries. So this can be further classified into two categories, that is the end-to-end anastomosis. Arterial can be of two categories, that is end-to-end anastomosis, and then we have a convergent anastomosis. ठीक है. End to end is arteries are joined end to end. For example, palmar arches. ठीक है, examples लिख लो, like palmar arches. ठीक है, like the palmar arches, इसको पढ़ेंगे हम डिटेल में. palmar arches, plantar arches, circle of circle of Willis. ठीक है. Then we have the convergent anastomosis. इसका classical example है जो बड़ा important है. सारे examples बड़े important है. ठीक है. Two arteries they join to form a larger artery. For example, the vertebral arteries, they join to form a larger basilar artery. ठीक है, ये हम डिटेल में पढ़ेंगे न्यूरोएनाटमी में. Okay, so this is the arterial anastomosis. That is the actual or the potential anastomosis. ठीक है, this is the actual anastomosis. Then you also have a potential arteries anastomosis between the terminal arterioles. Okay, no one is going to ask you, though I am just telling you an extra information. Like the suppose anastomosis of the coronary arteries. ठीक है, so in such anastomosis, the collateral channels they dilate gradually over a period, and sudden occlusion of the main artery, the potential anastomosis will fail to compensate the loss of the blood supply. ठीक है, so that is an extra point. So talking about the venous, that is communication between the adjacent veins. Suppose example would be, example, the dorsal arches. The dorsal arches of hand and foot. Okay, and AV anastomosis, or we can say shunting. Okay, so this is a communication between the artery and the vein. So it helps to supply the blood to the organ as per the need. So shunting vessels they prevent the entry of the blood as per requirement. So for example, AV shunts का example, okay. AV shunts का example, ये AV is shunts. ठीक है, AV shunts. Example, the skin of the nose. ठीक है, lips, external ear. Okay, mucous membrane of the nose. Right, and the tongue, tip of fingers. There are actually numerous examples. Tongue, tip of fingers, okay, and nail bed. Even the erectile tissue of the sexual organs. Okay, so this is anastomosis. Then we have something known as the end arteries. इस पे भी क्वेश्चन पूछते हैं वाइवा में. End arteries. Okay, what are these? So the arteries or their branches that do not anastomose with the adjacent arteries, they are known as end arteries. So it's a classical examples है कुछ जो याद रखने हैं, which is asked. So first one is a central artery of retina. Central artery of retina. ठीक है. Labyrinthine artery. Labyrinthine artery of ear. Okay. Then you have the central branches of the cerebral arteries. ठीक है. We have vasa recta of the mesenteric arteries. Then we have the arteries of spleen, kidney, lungs, and the metaphysis of long bones. ठीक है. So if the end artery is this, why this is so important? Because if end artery is blocked, you can imagine the area which is supplied by such artery, it will undergo ischemia and necrosis. Then there is something known as functional end arteries. So in case of coronary arteries, central branches of cerebral arteries, there is potential anastomosis. So here a sudden blockage of these arteries, it is not capable of development of a collateral circulation. So such arteries, they are called as functional end arteries. So okay, so like this, the coronary arteries, central branches, these are also known as the functional end arteries. Also example of functional end arteries. Okay. Then we have the types of circulation. Types of circulation. Okay. Types of circulation. So there are various types of circulation in the human body. So number one, that is the systemic circulation. Number two, we have the pulmonary circulation. Number three, we have the portal circulation. And number four, we have the fetal circulation. Okay. And this fetal circulation, this is in the during the embryonic life. ठीक है. So talking about the systemic, so इसमें systemic pulmonary हम already discuss कर भी चुके हैं. Systemic is circulation of the blood ejected from the left ventricle through the body, which has only one set of capillaries. So like the left ventricle, aorta, then arteries, then capillaries, veins, vena cava, and then right atrium back. Okay. So then we this in the systemic circulation, there is only one set of capillaries in the tissue. Then we have pulmonary circulation, the transport of deoxygenated blood from the right ventricle to the lungs and to bring back the oxygenated blood from the lungs to the left atrium. So if you remember, we have discussed this already in 3D. So okay, so we have seen this in 3D. Okay. So then we come on to the portal circulation, that is circulation which the blood flows through the two consecutive capillary networks before returning to the heart. So there are various examples of this portal circulation. So number one, that is the hepatic portal circulation. Hepatic portal circulation, that is present in the liver. Hepatic का मतलब ही liver है. ठीक है. Then you have, so this is one. Second type of portal circulation is hypophyseal portal circulation. ठीक है. So in this, it is present in the pituitary gland. Hypophyseal आ गया ना, it is present in the pituitary gland. ठीक है. So then we have the renal portal circulation, that is number 3. सॉरी, इसको नीचे कर देते हैं. ठीक है, we have the renal portal circulation. It is present in the kidney. ठीक है. So this is also an important circulation. Then you have the fetal circulation during the embryonic life. Okay, so you can see this fetal circulation. This is the fetal circulation. Okay. Now developing fetus, it receives the nutrition from the placenta, right? So this you will understand better in the embryology section. We will take it up separately in detail there. Okay, so we can write this in detail. In embryology in detail. ठीक है. So here let us understand few parameters here. So see, this placenta is there. So developing fetus, it receives the nutrition from the placenta. Fetus is dependent on the mother for nutrients and oxygen intake, carbon dioxide and waste product excretion. Okay, so you can write this main point here. The fetus is dependent on the mother for two things. Number one, that is the nutrients and oxygen intake. Number two, that is the carbon dioxide and waste product excretion. Waste product excretion. Okay, so this is something which is very basic for the understanding. Okay, so special structures in this fetal circulation, as you can see, I can highlight them. Number one, that is the placenta itself. ठीक है, it is a site of exchange of substances from between the mother and the fetus. Then you have the umbilical veins, which are carrying the nutrients and oxygen to the fetus. Then you have umbilical arteries. They are carrying the waste products and carbon dioxide away from the fetus. Okay, arteries और veins इसमें नाम different है. ठीक है. Then you have foramen ovale, that is the helping the blood to bypass the lungs. It transmits, because अभी breathing नहीं हो रही है ना fetus में, developing fetus में breathing नहीं है, so lungs are not active in this. So the blood is going not into the lungs, right? So it helps the blood to bypass the lungs. So it transmits most of the blood. See the arrows in the red. It transmits most of the blood from the right atrium to the right, from the right atrium to the left atrium. Okay, so see this, right से left atrium में blood transfer हो रहा है using this foramen ovale. Then you have something known as ductus venosus, which is transmitting the oxygenated blood from the umbilical vein, as you can see in this image, and the left branch of portal vein, okay, to the inferior vena cava. Thus again blood is bypassing the liver. So liver को bypass कर दिया हमने through ductus venosus. Then you have last, that is ductus arteriosus. That is the one which is helping the blood to bypass the fetal lungs. Okay, so it transmits the blood from the left pulmonary artery to the aorta. So you can see an anomalous connection, not anomalous, this is normal in the fetus. So the blood is transferring from the left pulmonary artery to the aorta. ठीक है. सो यहाँ पर एक कम्युनिकेशन है जो इट इज़ नॉट एविडेंट इन द एडल्ट लाइफ. ओके, यू नो दैट. So see this differentiation tables, I have already included them. We have discussed them in detail already, so I am not repeating them. So you can just see this tabulated differences and go through them for your exam, theory exams. Okay, difference between the blood, vascular and lymphatic system. So these are all as per NMC competencies only, nothing extra. Okay, so we have discussed most of them. Lastly, let us talk about the few words which are important as per the NMC competency. That is the thrombosis, okay, versus infarction, thrombosis, infarction and aneurysm. Okay, we have few words. थ्रोम्बोसिस पहले एक एक करके डिस्कस कर लेते हैं. The first one, that is the thrombosis. So thrombosis, it's a medical condition characterized by formation of a blood clot. So I'm writing the keywords, that is formation of a blood clot. Okay, that is the thrombus. इसलिए उसका नाम है thrombosis. Okay, so this is inside a blood vessel. Okay, so it will obstruct or partially block the affected blood vessel, disrupting the normal blood flow. So this can occur in arteries or veins, both. ठीक है. So when a thrombosis, when a thrombus, now listen carefully, when a thrombus dislodges from its original site and travels through the bloodstream, then it is known as embolus. ठीक है. So then you have the word, that is embolus. Okay, and which can potentially block the smaller blood vessels. Okay, so I can say a mobile thrombus is equal to a mobile thrombus. Okay, so this can potentially block the smaller blood vessels elsewhere in the body and cause severe complications such as can lead to pulmonary embolism or stroke. ठीक है, लंग्स में जाके कहीं वो फंस गया, और या फिर देयर कैन बी स्ट्रोक, ब्रेन स्ट्रोक. ठीक है, सेरिब्रल सर्कुलेशन में फंस गया. सो व्हाट आर द कॉजेज, बेसिक कॉजेज ऑफ थ्रोम्बोसिस? Number 1, that is the endothelial damage. Endothelial damage. Okay, so that can be due to the injury, or trauma, or surgery, or inflammation. ठीक है. Number 2, there can be stasis, or I can say blood flow disturbance. So this can be due to the prolonged immobility, like during long period of bed rest or air travel, congestive heart failure also. Okay, prolonged, due to the prolonged immobility or congestive heart failure, or it can be due to the venous insufficiency. ठीक है. Then you have number 3, that is the hypercoagulability. ठीक है, इसको डिटेल्स में पैथोलॉजी में पढ़ोगे, फिजियोलॉजी में भी बहुत कुछ है. ठीक है, दैट इज द इंक्रीज्ड टेंडेंसी टू क्लॉट. Number 4, that is a vessel wall injury. Now ये कब हो रहा है? In atherosclerosis. ठीक है. So that is about the thrombosis. Then we come on to the next word, that is the infarction. अब infarction क्या चीज़ है? That is tissue death basically. ठीक है, that means tissue death. Now this can be due to inadequate blood supply, to the affected area, inadequate blood supply, to the affected area. So this can be caused due to, ये इन्फेक्शन क्यों होगा, आर्टरी में ब्लॉकेज हो गया मान लो, ठीक है, कोई आर्टरी ब्लॉकेज हो गया, या फिर रप्चर ऑफ एनी आर्टरी, या फिर मैकेनिकल कंप्रेशन हो गया आर्टरी का, ठीक है, देयर कैन बी सम ट्यूमर ऑल्सो विच इज कंप्रेसिंग अपॉन इट, या फिर देयर कैन बी एनी वेजो कंस्ट्रिक्शन, there can be vasoconstriction. So the resulting dead tissue or lesion is known as infarct. ठीक है. So what are the causes of infarction? That is atherosclerosis, ठीक है, thrombosis itself जो अभी हमने डिस्कस किया, then embolism जो हमने डिस्कस किया, then vasospasm, ठीक है, vasospasm, inflammation and trauma, inflammation and trauma. Okay, so all these are the causes of infarction. ठीक है. Then you have the last word to be discussed as per the competency, that is the aneurysm. Aneurysm, ठीक है. So it's a sac like dilatation of the arterial wall. This is a sac like dilatation of arterial wall. Okay, so this is basically tunica media which we are talking about, tunica media. Okay, and because of its weakness, that is aneurysm means dilatation in Greek. Okay, so this is sac like dilatation of arterial wall due to its weakness. Okay, this is associated with replacement of elastic fibers with collagen fibers. Okay, replacement of the elastic fibers with the collagen fibers. Okay, and then usually it is seen in the old age. It is seen in the old age. That is due to the atherosclerosis again. ठीक है, और syphilis is a condition which you will read about later on. Syphilis, and also there is a syndrome that is the Marfan syndrome. ठीक है. Then talking about the other clinical integrations points, that is the deep venous thrombosis, DVT. ठीक है, deep, बस नाम सुना होना चाहिए, deep venous thrombosis, बिकॉज इसकी डिटेल्स बाद में आएंगी ही आएंगी फॉर श्योर. ठीक है, इसको हम लोअर लिम्ब में भी डिस्कस करेंगे, DVT. एंड वी ऑल्सो हैव अनदर डिसीज दैट इज द Berger's disease, also known as thromboangiitis obliterans. Thromboangiitis obliterans. ठीक है. So इसमें क्या होता है, deep vein thrombosis is the medial sized veins, especially in the lower limb, the thrombus can form. ठीक है, this is in the lower limbs. So it especially seen in the patients with prolonged bed rest, in orthopedic cases with cast for the treatment of fractures. So parts of such clots may get separated and enter the pulmonary circulation and can form blockage that can also lead to pulmonary embolism, again instant death. Then we have Berger's disease. This you will read about more in detail in the surgery. It is recurring progressive inflammation and thrombosis or clotting of small and medium arteries and veins of the hand and feet. Okay, so this can happen in the hands and feet. ठीक है, so it is commonly found in the tobacco users and smokers. This is found in the tobacco and smokers, tobacco users and smokers. ठीक है, so the main symptom is pain in the affected areas. So that's it about the cardiovascular system. I have tried my level best to cover almost all the important areas of this chapter. Okay, so if you face any problem, please do feel free to contact me, and keep on studying every day. Don't miss a day without studying. Okay, so take care. Bye bye.